Well, for more on this, we're now joined via Zoom by Helen Ottens-Patterson, who's Doctors Without Borders, Médecins Sans Frontières, head of mission in Gaza. Thanks very much indeed for joining us. Welcome to the program. And with the work that you do, you literally are on the front line of some of these bloody and horrific shellings and bombings that take place. Take us back to May last year, because you were in Gaza, and just tell us some of the things that you saw and had to deal with as Médecins Sans Frontières.
Good evening. Thank you very much for having me on the program. First of all, I'd like just to start by saying that we can't really look at the conflict, the Gaza conflict last year in isolation. We need to look at it against the backdrop of a 15-year blockade, a grinding and relentless blockade, which is imposed by Israel and also by Egypt. There have been repeated conflicts during that period of time. There have been 4 major offensives. For example, around 40% of the 2 million people who live in Gaza are children under 14 years of age, and during their short lifetimes, they've experienced 4 major offensives. So yeah, it's kind of a repeated, deeply ingrained trauma. There are physical injuries and there are mental injuries as well. For MSF during that time, fortunately, we were able to treat around 100 patients. We run a lower limb reconstruction unit, so it's a unit providing quite specialized surgical care. The injuries we treat are injuries which have damage to the bone, damage to the tissue, damage to the blood supply, and they require months, if not years, of medical treatment. So it's incredibly challenging, and of course, during that time, our medical teams were operating with huge courage in the most difficult of circumstances, making personal sacrifices to attend the hospital to treat the patients.
Resources must always be a difficult thing as we talk about this blockade. Hello, Helen, can you hear me?
Hello, yes, go ahead.
I was just saying that resources, particularly at a time of conflict, can be quite a difficult thing for medical staff, especially when we consider the blockade that you've described.
Absolutely, yeah. I mean, we are fortunate enough to be able to manage our own supplies relatively independently, but the Ministry of Health suffers huge deficits in supplies, and of course the blockade ensures that the situation in terms of access to healthcare is precarious at the best of times. During emergencies such as the conflict last year, supplies are very quickly depleted, and it's very hard to manage the patient load in these circumstances.
So the news cycle is there on the ground often and covers the conflict as it's happening. Tell us about what happens when the cameras have gone and the aftermath. What are some of the things that you have to deal with post a major conflict time, such as this time last year?
Gosh, well, it's just trying to provide that consistent medical support for our patients. As I mentioned, they suffer debilitating injuries, which actually mean that they're resigned or subjected to a lifetime of disability. So what we provide, as well as the surgical aspects, is rehabilitation. That rehabilitation is physical, but it's also mental and psychological, and it's an ongoing thing. There are also quite complex injuries, most of which can be susceptible to a bone infection called osteomyelitis. That infection itself is very challenging to treat. The drugs are very expensive. They're prohibitively expensive for the Ministry of Health in Gaza, even if they were able to get them in under the blockade conditions. The treatment of this disease, this osteomyelitis, means that patients often have to undergo up to 8 weeks of hospitalization, suffering pain, the isolation of being in a hospital room for a long period of time, and all of these elements just, it compounds the psychological injuries. We're talking about people who've dealt with with a lifetime of suffering, it's an incredibly cruel environment. So we try to offer holistic care. We work with a multidisciplinary team model. So we focus on really taking that patient through each step of the way and trying to enable them to face the rest of their life. But it's incredibly challenging. People have, they may know what they have in one moment, but they don't know if those things are going to exist in the next moment. The uncertainty is something which compounds everybody's mental health in Gaza.
And you've mentioned this mental health aspect quite a bit now, and I can only imagine children being exposed to extreme violence for a continued period of time is beyond abnormal. What are some of the consequences that you see with these kinds of exposures and the effects that they have on mental health?
Oh gosh, it's yes, absolutely harrowing to observe children who suffered things like post-traumatic stress disorder, different types of acute trauma, as well as chronic trauma. Some of them are, frightened by noises. They're not able to play as normal children. They've lost their friends, they've lost their siblings, they've lost their parents, they've lost their homes. A simple act of being able to go to school, is something that they can't take for granted. They're reminded constantly of these events, which have, marred their lives from a very early age. And it's very difficult to imagine, how they're going to be able to, live each day as their future unfolds, because their future, is this blockade. It is this ongoing occupation which affects all aspects of life. Yeah.
All right, let's talk a little bit about everyday life. Although we are talking about this conflict that happened at this time a year ago, and it's the fourth, as you said, major situation in a number of years. And I just wonder, every day since then, what is a typical week like in Gaza? What kind of things are you looking at, facing and having to deal with?
Yeah, I mean, our work continues. The limb reconstruction unit is open every day. We run outpatient services, we run inpatient services, and a hospital, as any hospital in any part of the world, functions 24/7. Patients are not, they're sick day in, day out. So our work revolves around that. It's something which encompasses this multidisciplinary team approach, as I said. So we have a big team of people from all sorts of professional walks of life, all working together to try to ensure the best medical care for the patients. During times such as now, it's very routine. It's fairly calm, but as I mentioned earlier, that calm can be broken at any moment. So you can't take anything for granted, and you need to make the most of every single opportunity you have to work and to maintain a high quality of standards.
The blockade, does it still to this day affect how you're able to deliver medicine and take care of people in Gaza?
Absolutely. I mean, this is the most crippling aspect of what we face on a day-to-day basis. It doesn't go away. It's grinding. It's unrelenting. It's cruel beyond words, and it affects every aspect of life, not least access to healthcare, which is, why MSF Belgium, Médecins Sans Frontières is present in Gaza. The blockade affects access to water, access to sanitation, access to fuel, access to food, access to light. Every aspect of daily living is affected to some degree by the blockade. You cannot talk about Gaza without talking about the blockade. The Ministry of Health is under extreme pressure because of this blockade. They suffer shortages of medicines, shortages of consumables on a daily basis, and they don't have any ability to have contingencies for times of war. So yeah, this is the reality that we face as a medical organisation trying to work here amidst these challenges, and you can imagine it's far worse for the population of Gaza and for the Ministry of Health.
Helen, we're going to have to leave it there. Thank you very, very much indeed. And we wish you the best in the work that you're doing and your continued safety with you and your colleagues. Thank you so much.
Thank you very much.